Good morning, students. How are you? Hope you are doing good. I'm also doing well with God's grace. Today's topic is congestive heart failure or heart failure. Okay. So hope you have go through with all the videos what I have uploaded in YouTube. Hope it is very benefit for you. You can able to brush up your knowledge and everything. If there is any doubt or if there is anything, you can just comment under the video, or you may be having my WhatsApp number, so you can send a message through that WhatsApp number also. Okay, thank you girls. So we can go to the today's topic. Today's topic is congestive heart failure, otherwise we call it as a heart failure. So when you come to the definition, it is the heart, it is inability to pump the blood and decrease the oxygen supply to the body. So here the heart failure is a inability of the heart to pump the blood out of the heart and to meet the oxygen demand of the organs of the body. So that we call it as a heart failure. When you come to the congestive heart failure, it is a progressive disease. So the cardiac muscles which cannot able to pump the blood properly and cannot able to eject the blood from the heart to the body and to the lungs, so which may lead to a failure. So that we call it as a congestive cardiac failure. Okay. So here in the congestive cardiac failure, we are having types. So first is left-sided heart failure, right-sided heart failure, systolic heart failure, diastolic heart failure, high output heart failure. So when you come to the types, we are having a left-sided heart failure, right-sided heart failure, systolic heart failure, diastolic heart failure. So from the name itself, you came to know which part of the heart which is get affected or which is get problem. Understand? So the first one is left-sided heart failure, which means the left side of the heart which is get affected. So that we call it as a left side heart failure. As you know already about the anatomy and physiology of the heart, hope you know. Understand? So this is the right atrium, right ventricles, left atrium and left ventricles of the heart. Understand? So when you come to the right side, which has the deoxygenated blood, in the left side which is have the oxygenated blood. Okay. So right side from the superior vena cava and inferior vena cava, from the lower parts of the body, from the upper parts of the body, it's receive the blood which is deoxygenated blood for purification, which is come and enter into the right atrium, and then it is come and enter into the right ventricles of the heart, and then through the pulmonary artery it goes to the lungs for a purification. After the purification through the pulmonary veins, it comes to the left atrium of the heart and to the left ventricles of the heart. So the left ventricles pump the blood through the aorta, and it pass the blood or supply the bloods to the all over the parts of the body. So this is the light brush up of the anatomy and physiology. So when you come to the right-sided heart failure, left-sided heart failure. So left-sided heart failure means, so the left side of the heart which is inability to pump the blood, So that what will be happening? It may leads to the demand of the oxygen and supplies the bloods to the parts of the body which is get decreased, and demand will be get increased. Understand? Okay, hope you understand. The left side of the heart which has the oxygenation, understand, oxygenated blood, it has to be supplied to the all the parts of the body. Okay. See, in a right-sided heart failure, this it may happen due to the left side heart failure also. And also, so due to that, what will be happening? Due to other causes, other extra heart causes like pulmonary causes, you see, it may leads to the what happened, that the eject of the blood from the right side of the heart which is get decreased. So that what will be happening, the purification also get decreased, and all the parts of the body will be a stagnation of the blood. So the person may be perceiving a symptoms of the edema in abdomen, in a face, in a lower extremities, so and then breathing difficulty. So like the symptoms will be shown by a person, those who are having a right side heart failure. Understand? Okay. The next one is systolic heart failure. Systolic heart failure. So the pumping mechanism of the heart, we call it as a systole. So here, the systolic heart failure means what? There will be the left ventricles of the heart which cannot able to pump the blood properly, and the muscles which cannot able to helps to pump the blood properly. So in the systolic heart failure, the ejection fraction of the heart will be remain. There is no changes in the ejection fraction, but the heart cannot able to ability to pump, which is get decreased. Okay, and next one is diastolic heart failure. In a diastolic heart failure, what happened? In a diastolic heart failure, the ventricles of the heart has to be relaxed, and it has to be get the pull the blood from the atrium of the heart. Understand? So here what is happening in the left ventricles of the heart, which cannot able to relax properly to get the blood. So that what will be happen? The supply of blood to the body which is get decreased, so that the demand of oxygen also will be increased. Okay, so in here right side heart failure also, the ejection fraction of the heart which is get remain or preserved. Understand? Okay. The next is a high output heart failure. So it is a very rare type of heart failure. So it is mainly happening due to the muscles of the left ventricle or tissues of the left ventricle which cannot able to pump the blood properly. So that what will be happening? The demand is increased, the output is decreased. Okay, so there is no high output and there is no output properly, the demand also will be increased. So this is very rare type of a heart failure. So these are the types of heart failure. When we come to the types, we are having a left side heart failure, right side heart failure, systolic heart failure, diastolic heart failure, high output heart failure. Understand? Next we move on to the causes. So when you come to the causes, we are having a two type of causes, that is a left side causes and right side causes. When you come to the left side causes, CAD. CAD means coronary artery disease. Hope you understand this. If you follow me in a previous videos, you understand what is happening in a CAD. And then heart attack, sudden cardiac arrest. And then high blood pressure of a person. So due to the narrowing of the lumen, and there will be a pressure is increased and flow is decreased. And then valvular disease. So valves of the heart, triple valve or a semilunar valve, so which is get defect. So that what will be happening? There is a closure and opening of the valve which is get difficult. So that the pumping of the blood also which is get difficult. Understand? Valvular disease. And then abnormal heart rhythm. Abnormal heart rhythm. So as you know, the SA node has to be start the rhythm and it has to be pass the rhythm to the AV node and it is to the Purkinje's fiber. So what happened? So it helps for a cardiac output. It helps for a cardiac output. So if there is any problem in a rhythm of a heart, so it will be directly affect the output of the heart. Understand? So that the blood cannot able to meet properly. And then myocarditis. So myocardial layer of the heart which is get infected or inflamed. What happened? Due to the inflammation, there is a formation of a flake. So due to the flake, the tissues which is get roughened, which cannot able to pump it properly, or there is no relaxation of the valves and then inner layer of the heart. So that what will be happening? It may leads to the relaxation and pumping capacity of the heart will be get decreased. Okay. And then congenital heart defect, ASD, VSD, tetralogy of Fallot. So due to that, what will be happening? There will be a pooling of a blood in between. There is a mixing of the oxygenation and deoxygenation blood. So in between the septum. So that what will be happening? There is no pool out of the blood from the heart and there is a mixing of a blood inside the heart. So the demand will be increased. Oxygen level is very decreased. Okay. So this is the cause of the left-sided heart failure. So when you come to the right-sided heart failure, maximum it is the same. CAD, high BP and high blood pressure in the lungs. So if you see there is a clot in the pulmonary arteries, so what may be happening? So there is no blood passes, understand? So here the pressure of the lungs will be get increased, so which cannot able to take place of a purification of the blood. And then pulmonary embolism. There is embolism which is present in the pulmonary artery, which cannot able to pass the blood from one side to the another side. So it is helps to prevent the purification of the blood from the alveoli, by the alveoli. And then COPD. When you come to the COPD, what is happening? The alveoli which is get disrupted. So here it is the alveolar tissues are muscles which cannot able to attain a work properly. It is full of a secretion and it is get destroyed its own function. So that the purification will be get released, get decreased in a COPD patients. So this is the causes of the right-sided heart failure. The next is the risk factors. When you come to the risk factors, DM. So DM, it is a metabolical disorder. So due to a DM, there will be a chances of a calcification and there is a chances of a deposition, so that there will be a leads to a heart disease. The area leads to a heart disease. Obesity, due to a sedentary lifestyle, there is a deposition of an increase in the cholesterol level, so that the person may be developed with the cardiac failure. Sleep apnea, and then older age, smoking already you know, and then toxins. Some of the toxins which is disrupt the heart muscles to pump the pumping capacity. Autoimmune disease which is affect the cardiac cells or heart muscles, so which may lead to the disrupt the functions of the heart. And then cardiotoxicity. So the person, those who are in an oncology treatment, those who are getting a chemotherapy treatment, so by the time the particular drugs will be directly affect or directly give a toxins to the cardiac muscles. So due to that, the person may end up with the heart failure. Understand? So here we have seen about the types and causes of the right heart failure, left heart failure, and causes of the right heart failure. And then next we move on to the pathophysiology. First we are going to see three pathophysiologies here. First is a common pathophysiology of a heart failure. Next one is a pathophysiology of left-sided heart failure. Third one is a pathophysiology of a right-sided heart failure. Understand? Okay. The first one is, it is a pathophysiology of a common heart failure. Here, decreased blood volume. Due to any other cause, there is the volume of a blood which is get decreased. So it just leads to a stimulate the sympathetic nervous system of a person, so that what will be happening due to the stimulation of a sympathetic nervous system, there is a release of epinephrine and norepinephrine. So this release of epinephrine is norepinephrine, we consider as a compensatory mechanism. So it will be directly affect the blood vessels of a person. So they directly affect the blood vessels of the person. So in that blood vessels, what will be happening? It may leads to the vasoconstriction. So that after that, what will be happening? Due to that, there will be a release of the renin. So due to the release of the renin, there will be a formation of angiotensin 1. So this mechanism will be taken place in a kidney. So here there is a formation of angiotensin 1. So it forms the angiotensin converting enzyme. So this will be converting the angiotensin 1 into a angiotensin 2. Okay. So here, this angiotensin 1, this angiotensin 2 conversion which release the aldosterone. So this aldosterone, what is happening due to the aldosterone? There is a retention of water, sodium, and stimulation of antidiuretic hormone. Understand? So here what is happening? So there is a release of the epinephrine and norepinephrine. So due to the epinephrine or norepinephrine, so here this will be leads to the vasoconstriction. So vasoconstriction, what may be happening? The blood supply will be get decreased. So due to the decreased blood supply, there will be a release of the renin by the kidneys, and it is form the angiotensin 1 and create the converting enzyme. So this enzyme which convert the angiotensin 1 into a angiotensin 2. So and then release of the aldosterone. So what is the happening of the aldosterone is it is retention of the water and sodium. So due to the retention of the water and sodium in the body or in the kidneys, what will be happening? It is developed with the edema. And then it is stimulation of the anti-diuretic hormone. Diuretic hormone which helps to release of the water and sodium from the body and relieve the edema. Here anti-diuretic means it is opposite function of the diuretic hormone. So that again there will be a fluid will be get retention in the body, which may leads to the fluid overload. So that due to the fluid overload, which may leads to the increased preload and afterload and increase the heart workload. Understand? Preload and afterload, before the getting the blood, there is a amount of blood which is present inside the heart. Afterload means after the pumping of the blood also, there will be a presentation of blood in the heart. It is simple meaning. Okay, so that what will be happening? That increase the workload of the heart also. And then that may leads to the cardiac muscles become fibrosis. Due to the inflammatory process, it may become a fibrosis and it is decrease the contractility of the heart. The relaxation and contraction of the heart will be get decreased. So that it may leads to the ventricular hypertrophy. So there is a relaxation of the muscles of the ventricles, ventricular hypertrophy. So which may leads to the diastolic heart failure and systolic heart failure. Okay, during the systolic it has to be pumped. During the diastolic it has to be relaxed. So what happened here? The ventricles of the heart muscle which is get relaxed. Relaxed means hypertrophy. So the normal laxity of the heart muscles functions will be get decreased, so that the person may be developed with the diastolic and systolic heart failure. Understand? So due to the decreased blood volume, there is a stimulation of the sympathetic nervous system. So due to this sympathetic nervous system stimulation, there will be a release of the epinephrine and norepinephrine. That may leads to the vasoconstriction and it may leads to the stimulation of renin. It converts the angiotensin 1 into angiotensin 2 and that release of the aldosterone. Due to that, there will be retention of the fluid and then release of the antidiuretic hormone also. So due to that, there will be a fluid overload in the body as well as in the heart, and then increased preload, afterload and increased workload of the heart, which may lead to the fibrosis of the tissues of the heart, and then there will be a decreased contractive capacity of the heart muscle, which may lead to the ventricular hypertrophy. That may lead to the diastolic heart failure and systolic heart. Okay students, now we move on to the pathophysiology of left side heart failure. Okay, so here the heart cannot pump the blood into the ventricles and the systemic circulation. So it leads to pulmonary congestion, increased ventricular end diastolic blood volume and blood pressure, ventricular end diastolic blood pressure, and that may lead to the blood volume and pressure which is increase the left atrium of the heart. That may lead to the decreased blood flow from the pulmonary vessels, which may lead to the pulmonary blood volume and pulmonary blood pressure which is get increases, which is leads to forcing of the blood from the pulmonary vessels to the pulmonary tissue and alveoli, which is leads to pulmonary edema and impaired gas exchange, and that leads to increased pulmonary pressure and decreased tissue perfusion, which may lead to decreased stroke volume and stimulation of sympathetic nervous system, release of renin, release of aldosterone, fluid overload, which may lead to increased cardiac workload and leads to left ventricular hypertrophy and leads to left ventricular failure. So this is the pathophysiology of the left ventricular failure. The first thing is the heart cannot pump the blood into the ventricles and into the systemic circulation. Understand? So here there is no blood cannot able to come into the ventricles and into the up. Understand? And then there is leads to pulmonary congestion. Pulmonary congestion. So you might have seen, you know about that. This is the lungs. So the blood after the purification come through the pulmonary veins into the left atrium of the heart and into the left ventricles of the heart, and it will be pumped into the parts of the body. So here what is happening? The blood cannot able to come to the ventricles. So that what will be happening? The blood will be pooling inside. The blood will be pooling inside. So that it may leads to the pulmonary congestion, lung congestion. So that it leads to the increased ventricular end diastolic blood volume and end diastolic blood pressure. So end diastolic means what? After the relaxation, the volume of the blood and pressure of the blood in the ventricles which is get increases. So that which may leads to the, there is a volume of the blood and pressure of the blood will be get increase. How it is? So due to the congestion, when it is get dilatation, by the time the pressure and the volume increases means the left ventricles of the heart which has a blood inside. Understand? So after that what will be happening? The blood which cannot able to come inside the left ventricles of the heart. So because already in this chamber which is pooling of the blood. Okay. So that what is happening? There is a blood volume and pressure which is increased the left atrium of the heart. Blood volume and blood is increasing in the left atrium of the heart. So that decrease blood flow from the pulmonary vessels. Decrease. So here also there is a blood will be increased. Here also there is a blood will be increased. There is no place or space to accommodate the new blood for each ejection. So that what will be happening? The blood which is inside the pulmonary vessel, so that the pulmonary vessel which cannot able to take the blood inside the left atrium of the heart. Okay. So that what is happening? The pulmonary blood volume and pulmonary blood pressure will be get increases. So the here there is a volume and the pressure of the lungs which is get increases. So that what is happening? Here you see this is the alveoli. So this is the blood. Understand? This is the blood. So here due to the purification it will be get into the alveoli. After the purification it came out from the alveoli. So here already there is a blood in the pulmonary vessels. There is a blood in the pulmonary vessels. So it cannot able to accommodate the new blood. So due to here the pressure is increases, the volume also get increases. So due to that what is happening here? The forcing of a blood from the pulmonary vessel into the pulmonary tissue and alveoli. So that it forces the blood into the alveoli and the tissue of the pulmonary. So that it may leads to the pulmonary edema. The alveoli which has the congestion of the blood. Pulmonary edema and impaired gas exchange. So here the alveoli which is full of a fluid, full of a congestion, it cannot able to receive blood and purify the blood. So that it may happen leads to the decreased stroke volume and then stimulation of the sympathetic nervous system and release of the renin and release of the aldosterone. Already you know this process. So here it end up with the fluid overload and then increased cardiac workload in order to meet the functions of the body and meet the functions of the organs. It is work hard also. So that it may leads to the, so again and again there is a pooling of a blood. There will be a hypertrophy of the left ventricles of the heart and that may leads to the left ventricular failure. Understand? So here what is happening in a left side heart failure? So here due to the problem in the left ventricles of the heart, there is a pressure in the end diastolic pressure and end diastolic volume which will be get increases. So that the left atrium also will be increasing the pressure and the volume. It cannot able to receive a blood from the lungs through the pulmonary vessels. So that the blood which is present in the lungs which is get congested and it may leads to the pulmonary edema and pulmonary congestion. So that due to a pressure, It is forcing the blood from a pulmonary vessel into the alveoli and into the tissue. So that what is happening here, the alveoli, which is full of a fluid, it cannot able to do a purification of a blood, and it may leads to the decreased stroke volume, stimulation of sympathetic nervous system, leads to fluid overload, and then there will be a hypertrophy of the left ventricles of the heart, which may leads to the left ventricular heart. Okay guys, this pathophysiology is right side heart failure pathophysiology. So here, due to the failure of the left side of the heart, so there is a pulmonary interstitial edema which leads to right side of the heart cannot eject the blood. So there is a congestion in the peripheral tissue which may leads to increased venous pressure and capillary hydrostatic pressure. That may leads to inner extremities, which is leads to the lower extremities edema, that is a dependent edema. So that edema will be gradually up the thighs, legs and genitalia. Okay, valvular edema also. And then next one is venous enlargement of the liver, which may leads to the secondary liver failure and hepatomegaly. In a secondary liver failure, which leads to the portal hypertension, force the blood fluid into the abdominal wall and form the ascites and GI distress. And then hepatomegaly leads to increased pressure in the diaphragm and respiratory distress. And then there is a increased venous pressure and capillary hydrostatic pressure in the GI tract. There is a venous stasis in the abdominal organ. There is inadequate removal of the catabolic waste product, which may leads to the edema of the all over the body, and it may leads to the multiple organ dysfunction. And then other time it leads to the jugular vein distension also. Okay, so here, so due to the failure of the left side of the heart, so already we saw in a left side heart failure there is a hypertrophy of the left ventricles of the heart, hypertrophy of the left ventricles of the heart, which may leads to the there is a hypertrophy of the left atrium of the heart and the left ventricles of the heart. So that is the left side heart failure will be taken place. So due to the left side heart failure, it is that again it is affected into the right side heart failure. How it is affect? So here in a right atrium and in a right ventricles of the heart, so it is receiving the blood from the body through to the superior vena cava and then inferior vena cava of the heart, of the vessel. Understand? So it is lower parts of the body and then upper parts of the body. It receives the bloods for a purification. And then from the right atrium, it is pulled into the right ventricles of the heart. Through the pulmonary artery, it goes to the lungs for a purification. Okay, this is the normal process. So here, what is happening? It is already there is a failure of the left side of the heart, and then there is a congestion of the blood in the or congestion of the pulmonary. There is a hosing of the blood from the pulmonary vessel into the alveoli and into the tissues of the pulmonary. So this is what happened in a right-sided heart failure. Understand? So here the blood pumps the blood from left ventricle into the lungs again. So here there is no chance of purification, so that it cannot able to eject the blood from the right side of the heart, because already the lungs is overwhelmed with the fluid and there is no room to accommodate the blood which is coming from the right side of the heart, so that there is a congestion. So there is a stopping of a blood from the right ventricle to the lungs. And then by the way, there is a stoppage of a blood. It cannot able to take a blood from the right atrium, because the right ventricles already there is a blood. And then in the right atrium, which cannot able to take a blood through the inferior vena cava and the superior vena cava of the body. So that what will be happening? This cannot able to receive the blood from the lower parts of the body and the upper parts of the body, so that it may lead to the congestion in the peripheral tissue. Congestion in the peripheral. So the organs and the body tissues which is get the fluid in a congestion, which may lead to the increased venous pressure and capillary hydrostatic pressure. Due to that, what is happening? If it is extremities, mainly the first affect part of the extremities is the lower extremities. There is a dependent edema will be taken place, and then the edema which is upgrade from a lower extremities to the upper, and it will be gradually to the thighs and to the genitalia of a person. Okay. The next is, it is the major organ is a liver. Understand? First, the liver which is get enlarged. So due to the enlarged of the liver, it is end into the secondary liver failure. So secondary means the cause which is exactly happening in a liver, it is extra liver cause. So secondary liver failure which is taken place, due to that there is a portal hypertension, portal vein hypertension. Due to a portal vein hypertension, what is happening? Force a blood from the vessel into the abdominal cavity. So it is form a ascites, collection of fluid in the abdominal layer. It form as a ascites. The person may be developed with the GI distress. The other again, it leads to the hepatomegaly. Hepatomegaly means enlargement of the liver. Due to the enlargement of the liver, there is a upon pressure to the diaphragm, so that the person may be leads to the respiratory distress. If it is in a GI tract, there is a stasis of the blood, venous stasis in the abdominal organ. So there is a inadequate removal of the catabolic waste product from the major organ. It may be leads to the organ failure, major organ failure. And next, there may be a distension of the jugular vein. So this is what happening in a right side heart failure. Right side heart failure. Due to a failure, there is no ejection of a blood from the right side, and then congestion of the blood in a peripheral tissue, increased venous pressure, and then capillary hydrostatic pressure. So it is happening in the edema and up to the genital edema. Venous enlargement in the liver, secondary liver failure, and hepatomegaly may lead to the GI distress as well as the respiratory distress. And then GI tract, there is a major organ dysfunction, and then jugular vein distension. Clinical symptoms of heart failure. Okay. So first symptoms of heart failure, congestive heart failure is shortness of breath, chest pain, palpitation, fatigue, swelling in the legs, ankle and abdomen, weight gain, dry, barking, cough. It is a specific sign of congestive heart failure. Bloated stomach, hard stomach, and then loss of appetite, nausea, stomach upset. So this is what happening. And then in a left side heart failure, there is a constant cough will be present, shortness of breath will be present, weight gain due to the congestion, there will be a weight gain, and then edema which is present in the lower extremities, and then abdomen, and then genital area, and then the person is walking with the bending. So this is what happening in a left side heart failure. In a right side heart failure, there is a ascites, there is the fluid which is present in the abdominal layer. Already we have seen in a pathophysiology. So due to that, the forcing of a fluid from a vessel to the abdominal layer, so that may leads to the development of or build up of the fluids in the abdominal layer, which cause the ascites. And then breathlessness, due to that may leads to the hepatomegaly, which is leads to the diaphragm, which is pushed the diaphragm by the liver, and respiratory distress will be present. And then chest pain, discomfort, nausea, vomiting, and bloating of the abdominal, and then loss of appetite, and then loss of muscle mass will be present. So this is the clinical sign of left side heart failure, right side heart failure, congestive heart failure, shortness of breath, chest pain, palpitation, fatigue, swelling of the leg and ankles and abdomen, weight gain, dry barking cough, and then bloated stomach and hard stomach, loss of appetite, and then nausea, stomach upset. Left side heart failure, constant cough, shortness of breath, weight gain, and then edema which is in the lower extremities, and then up to the thighs and the genitalia, walking with bending. And when you come to the right side heart failure, ascites, breathlessness, chest pain, discomfort, nausea, loss of appetite, bloating, and loss of muscle mass. Okay, next we move on to the diagnostic studies. Mainly diagnostic study is a history collection. We have to collect a history of CAD or history of CAD with the family or anything. We have to collect a history of a person. And then physical examination, we have to compare all the clinical signs. We have to check for the edema. We have to check for the breathing, the abdominal distress. We have to check for the weight gain. We have to check for the respiratory distress. We have to check for the cough, we are check for the nauseated, we are check for the enlargement and hard stomach. So that and all we can find out with the help of the physical examination. And then blood investigation, mainly we are doing the ENP and then cardiac biomarkers and then LFT and RFT of a person. Why we are doing LFT and RFT? We have to check the cholesterol level and to check the liver function. Here there is a secondary liver failure, so that we are checking the LFT. RFT, why we are checking? Due to that there will be release of a renin and then it shows that the kidney will be get injured and it need a help. So in order to check that, we are checking the RFT also. And then we are doing the cardiac catheterization in order to find out what is happening. There is any pulmonary embolism, is there is any embolism in the blood vessels of the, if there is any problem in the valvular disease, or that and all we are going to find out with the help of the cardiac catheterization. And chest x-ray in order to find out the enlargement of the heart, and the echo, the motion of the heart muscles and the layers of the heart muscles, how the patency of the valve, that and all we are going to find out with the help of the echo. And then heart MRI and then cardiac CT and then exercise stress test and myocardial biopsy. Why myocardial biopsy? In a cases we have seen that there is a myocarditis. In order to find out what's the exact cause of a myocarditis, we are doing the myocardial biopsy. This is the diagnostic studies of the congestive heart failure or a heart failure. Next we move on to the management of congestive heart failure or heart failure. The first management is a pharmacological management. AC inhibitor, administration of AC inhibitor, angiotensin 2 receptor blockers, beta blockers, diuretic, aldosterone antagonist, inotrope, digoxin, anticoagulants, cholesterol lowering drugs. Okay, the first is ACE inhibitor. Already we have seen in pathophysiology. ACE converting, angiotensin converting enzyme, which convert the angiotensin 1 into a angiotensin 2. So here it is inhibit the conversion. So the example is captopril. So that's the way it will be prevent the fluid overload. Okay. Next one is angiotensin 2 receptor blocker. 2 receptor blocker means, so here the conversion which taken place and it cannot able to attain by a receptor which is convert from angiotensin 1 to a angiotensin 2. So it is a pulsatron we are administering. Beta blockers, this beta blocker which is block the stimulation of sympathetic nervous system. Already we have seen in a pathophysiology, sympathetic nervous system which gets stimulated and it is release of renin and release of converting the 1 into a 2 and aldosterone and retention of a fluid. So it is the block the stimulation of a sympathetic nervous system. Metoprolol. Diuretics, it is relieve the fluid from the tissues and the cells. So we are administering the furosemide. And then aldosterone antagonist. Antagonist means opposite reaction to the aldosterone. We are administering spironolactone. Aldosterone, which is retention of water, here it will be relieve the water and sodium from the body. Next is inotropes to maintain the pressure and to improve the heart ability of the heart to pump. We are administering digoxin, it maintains the heart rate. Anticoagulants, it prevent the clotting of the blood and it is thin the blood. Cholesterol lowering drugs, it helps to prevent the deposition of the cholesterol in the lumen of the blood vessels. Okay. Next is other management, cardiac resynchronization of therapy, CRT therapy. And then electrical cardioversion, ICD, and then LVDA, left ventricular assist device, and then surgical management, CABG, valve replacement, and then heart replacement. So here The first one is cardiac resynchronization therapy. It is called it as a CRT therapy. So here what is happening means it is an implantable device which is we are placing inside the heart. So this device which is helps to stimulate the heart to pump, and it is helps to stimulate the maintain the cardiac rhythm of a heart. Okay. The next is electrical cardioversion. You might have studied about the rhythm of the heart, which is get a factor. So it is provide the impulses to the heart. It is improve the cardiac stimulation or cardiac rhythm. I see the implantable cardiac defibrillator. So here it is we are like I say this, we are placing inside the heart. It is helps to stimulate the heart muscles, whether the signals which shows that the rhythm of the heart will be get decreased. And then left ventricular assist device, it is helps to it is like that. If you see, this device will be placed in the left ventricle of the heart. So like the ventricles of the heart. So it is helps to push the left ventricles of the heart and pull the bed, and it helps to relaxation of the ventricles of the heart. Okay. So that's the way it will be prevent the hypertrophy, and it will be prevent the fluid overload. And then other surgical method is coronary artery bypass graft, and then valvular replacement. If there is any problem with the valves, we are go with the valvular replacement. And heart transplantation. There is a serious failure of the left ventricles of the heart, left side of the heart. We have to go with the heart transplantation. So this is the pharmacological and other management of the congestive heart failure. Okay. The next is a prevention. In which way and all we can prevent the congestive heart failure? We have to do educate the person to do a normal physical activity, and then maintain the healthy weight, and then maintain management of stress, like relieve the stress. We have to ask the person to do techniques which is helps to relieve the stress, and quitting of the smoking and tobacco using, and prevent the obesity. When you come to the complications, it may lead to the irregular cardiac rhythm, and then sudden cardiac arrest, heart wall problem, and pulmonary hypertension. There is a damage to the kidneys and the livers due to the congestive cardiac failure. Health education. So health education which helps a person to prevent the disease and to improve the healthy lifestyle of a person. So that we have to ask the person to quitting the smoking, a cessation of the smoking, and then continuous weight monitoring, healthy diet, salt restricted diet, and reduce the stress and improve the sleep pattern of a person. When you come to the nursing diagnosis, decreased cardiac output, and then ineffective breathing pattern, excess fluid volume related to the decreased cardiac output. Understand? So this is what the management of the congestive heart failure. Pharmacological management, ACE inhibitors we have to administer, angiotensin 2 receptor blockers we have to administer, beta blockers, diuretics, aldosterone antagonist, and then inotropes, digoxin, anticoagulant, and then cholesterol lowering drugs. Other management, CRT therapy, electrical cardioversion, and then LVDA, LVAD, and then ICDs, and then we have to go with the surgical management of CABG, valvular replacement, heart transplantation. Okay, when you come to the prevention, we have to improve the physical activity, educate the person, and then maintain the healthy weight, and then management of stress, quitting the tobacco, and then smoking, and prevent the obesity. When you come to the complication, that may lead to the irregular cardiac rhythm, and then improve the sudden cardiac arrest, and then heart wall problem, and then pulmonary hypertension, kidney and liver damage, and malnutrition. And then we have to provide a health education, ask the person to cessation of smoking, and then weight monitoring or weight maintenance, healthy diet, restrict the salt intake, reduce the stress, and proper sleep. Nursing diagnosis, decreased cardiac output, ineffective breathing pattern, excessive fluid volume related to decreased cardiac output. So that's all about the congestive heart failure. Today we have seen about the congestive heart failure. I explained about the left side heart failure and right side heart failure. Hope you can able to understand this video and you can able to gain more knowledge about this. Okay. So if you have any queries or any questions, kindly place it in a comment, and if you want any other topic also, kindly place it in a comments. Hope I will see you in the next video. Thank you. Bye bye. See you.